Ready, Amy? Good afternoon, it's Monday, May 9th at 4:29 p.m. I'd like to call this Board of Health meeting to order. May I have a roll call, please?
Yes. I'm sorry, just a second.
It's all right.
Andy Hornstrom
Yes.
is present, and Kyle.
Yes.
Okay, and we do have a quorum.
Wonderful.
Okay.
I would entertain a motion to approve the agenda.
So moved.
Second, any discussion? All those in, roll call, please. Oh, no, we can do all those in favor. Sorry, it's been so long since I've been in person. This is weird. All those in favor, sign of aye.
Aye.
Opposed? That carried. Is there any public participation? Seeing none. Correspondence?
No,
Yep.
I don't think so.
Old business? Seeing none. Treasurer's report. Ron?
Yep, we have 2 months, February and March. We had a computer hiccup last month, so the official for February unofficial cash on hand was a little over $6.7 million with a fund balance of $6.9 million. That's representing 39% of the budget expenditures for the year. The surplus of $496,601. Total revenue for the end of February was just shy of $9.4 million, which is $1.977 million under the year-to-date budget. Expenditures were at $8.9 million, which was $3.1 million under the year-to-date budget, mostly due to personnel and benefits not being completely filled out. For March, the unofficial cash at the end of March was $6 million with a total fund balance of $7.2 million. That's representing 41% of the budget expenditures for the year. We moved up in our surplus from just under 500,000 to just shy of 800,000, and I understand that's from billing that was sent out quarterly and then received. Total revenue just over 10.8 million, 1.9 under the year-to-date budget. Expenditures following suit, just over $10 million in expenditures, 3.3 million under the year-to-date budget.
Any questions for Ron? Mandy, do you have anything to add? No? I would entertain a motion to put all three of those on file.
So moved.
Second, discussion? All those in favor, sign of aye.
Aye.
They are placed on file. I will combine the approval of payments to Board of Health appointees. So we have Treasurer Ron Fields for services in April 2022 in the amount of $384.84. Administrator Julie Pride for mileage to conference in Springfield in the amount of $100.62. Legal counsel Ruth Wyman in the amount of $675. Legal counsel Ruth Wyman, I'll specify the dates, my apologies, from February 16th through March 8th in the amount of $500. And Ruth Wyman from March 24th through April 15th in the amount of $375.
So moved.
Second, discussion? All those in favor, sign of aye.
Aye.
Opposed? Those are approved. Accounts payable invoices to be approved by the Board of Health. We'll do these individually just because they're fairly significant. Emergent Devices Inc. for Narcan in the amount of $50,220. Check requisition 3620.
So moved.
Second. I assume that's grant-based, Julie, right?
Yeah.
We have a grant for it. Any other discussion? All those in favor, sign of aye.
Aye.
Opposed? That carries. University of Illinois College of Vet Med for GIS spatial analysis from July 1st, 2021 through December 31st, 2021 in the amount of $5,400.
So moved.
Second. Any discussion? All those in favor, sign of aye.
Aye.
Opposed? That carries. And visit Champaign County Foundation for sponsorship of the Champaign County African American Heritage Trail marketing for the amount of $5,000.
So moved.
And second, discussion? All those in favor, sign of aye.
Aye.
Opposed? That carries. Review of monthly credit card statements. Any questions? Hearing none. All right. Approval of lease agreement between Children's Advocacy Center and CUPHD for rental of office space at 201 West Kenyon Road from July 1st, 2022 through June 30th, 2023 for the amount of I don't think I'm missing a number, but $1,922.85 per month. Is that right? Okay.
So moved.
Second, discussion. All those in favor, sign of aye.
Aye.
Opposed, that carries. Approval of rental agreement between Ellen McCullough, landlord, and CUPHD for office space at 223 East Mulberry Street in Watseka, Illinois, in the amount of $1,950 per month.
So moved.
Second, is that July 1, 2022 through June 30th, 2023 also? Okay. All those in favor, sign of aye.
Aye.
Opposed, that carries. Ratification of a pending grant contract between CUPHD, which subcontracts with East Central Illinois HIV Care Connect, using funds from the Illinois Department of Public Health and Carl Foundation Hospital for maximum reimbursement to the subcontractors for $150,000 for laboratory services provided between April 1st, 2022 and March 31st, 2023.
So moved.
Second, so this is just pass-through money.
Andy?
Is that effectively right?
That's another grant.
Okay. Any other discussion? All those in favor, sign of aye.
Aye.
Opposed? That carries. Approval of intergovernmental cooperation agreement between the State of Illinois Department of Central Management Services and CUPHD Local Government Health Plan.
So moved.
Second, is there a cost with this? Or is it just?
It's running us about $120,000 a month for the health insurance. It includes dental and vision coverage as well.
So the actual agreement though, there's no cost?
There is no
We're
cost
just-
associated with
okay,
it. Yeah,
okay,
we
we're just
have to
signing the agreement.
Correct, yes.
Gotcha. Any other discussion? All those in favor, sign of aye.
Aye.
Opposed? That carries. Approval of quote for 2 new sensors for diagnostic imaging in the child and teen dental clinic from Benco Dental in the amount of $14,443.
So moved.
Second, discussion. All those in favor, sign of aye.
Aye.
Opposed? That carries. We're really moving along. Approval of remote and hybrid work schedule policy and guidelines.
So moved.
Second. Is this just something we didn't have pre-COVID?
That's correct, yeah, and we're just gonna try to be more flexible and allow some more like remote work and flexible schedules.
I love it. Kyle, any other questions? All those in favor, sign of aye.
Aye.
Aye. Opposed? That carries. And now approval of flexible work schedule policy. Is that the same thing or different?
It's, one of them is for hybrid and one of them is flexible schedule. It was easier to write them separately because
Okay.
there were quite a bit of difference in the two.
Okay.
So moved.
Second, discussion. All those in favor, sign of aye.
Aye.
Opposed? That carries. And I'm scrolling down to the bottom to see if there's any pending grant contracts. I think there are. Oh, there are. Between CUPHD and Carl Foundation Hospital.
This is actually one that we.
Oh, this is the one we already
Yeah,
did.
I
Okay.
did by error.
Okay, no, that's fine. So there are no additional pending? So the next meeting will be a study session, Wednesday, May 25th, if needed at 10 a.m. And the monthly board meeting on Monday, June 13th, 2022 at 4:30 p.m. at CUPHD. If nobody has any other business, we will be adjourned at 4:38.